Na asante sana. Hapa tuko katika hoteli moja hapa jijini Nairobi, ambapo Wizara ya Afya imeandaa hamasisho dhidi ya ugonjwa wa Mpox. Ambapo hapa tu tumekuwa na wanahabari na pia wale madereva wa masafa marefu maarufu truck drivers, ambao wanasemekana kwamba wako katika hatari ya kutangamana na ugonjwa huo kutokana na hali yao ya kazi, ikikumbukwa kuwa wao ndio hutembea sana na kuvuka na kukutana na watu wengi katika miji mbalimbali na pia kuvuka nje ya nchi. Na hii leo Wizara ya Afya imekuwa na mkutano pamoja na washikadau katika sekta ya afya kuangazia jinsi ugonjwa huu ambao unatoka kwa wanyama na kuambukizwa kwa wanadamu itawezwa kupunguzwa, ikikumbukwa kwamba hadi sasa katika nchi ya Kenya tuko na visa 36 ambavyo vimeripotiwa tangu kuanzishwa tangu kuripotiwa katika visa ama kisa kile kimoja. Na sasa hivi wanasema kwamba kaunti ya Nakuru imekuwa ndio ina idadi kubwa zaidi, ikiwa na watu 10 ambao wameweza kuambukizwa ugonjwa huo. Katibu katika Wizara ya Afya Bi Mary Muthoni akisema kwamba Nakuru, ikizingatiwa kwamba ile nchi ya Nakuru watu wengi ambao wanatoka katika eneo la Mombasa, Malaba, lazima watatangamana pale, na pia wametoa tahadhari akiwataka Wakenya wawe na ile hali ya usafi zaidi na pia kupunguza kutangamana zaidi. Ukikumbuka kwamba wakati wa ile corona kulikuwa na ile ambao walikuwa wameweka mikakati kutoka Wizara ya Afya kusema kwamba itasaidia pakubwa. Pia mji wa Mombasa imeangaziwa kwamba pia ina visa 8 hadi sasa, na kwamba sasa kufikia sasa hivi katika nchini Kenya tumepoteza mtu mmoja tu, na ambaye alikuwa ni truck driver pia kutoka kaunti ya Bungoma. So mkutano wa leo tumekuwa hapa na wizara, washikadau kutoka UNICEF na WHO, Africa CDC pia walikuwa hapa ili waweze tu kuzungumza pamoja na pia wanahabari ya jinsi ya kuangazia ili kupunguza kusambaa kwa ugonjwa huo. Na hapa katika mkutano huu pia wameweza kuangazia na kuzingatia pia chanjo, ambapo wanasema kwamba Wizara ya Afya iko tayari, watu wataweza kupata chanjo, na pia mwisho wanasema pia wataweza kukuwa na ile tu mikakati ili ya kuzuia katika maeneo ama zile wanasema borders zetu katika nchi ya Kenya. Na hii mkutano tu inaendelea na wataendelea tu kuzungumzia masuala mbalimbali ili waweze kuangazia na kuona kwamba ugonjwa huu usiweze kusambaa zaidi.
Ladies and gentlemen, it is important to note that Mpox remains a very, very big threat, not just in Kenya, but the East African region and in our country at large. We have seen in the past 1 week, we have confirmed 5 new cases, 3 of which were reported just 2 days ago. And the 5 new cases have been reported from a number of counties. That includes Kericho, 1 case, Taita Taveta, 1 case, which was reported on 17th of January 2025. The most recent cases, as reported on 21st January 2025, have been reported from Busia, 2 cases, and Kilifi, 1 case. This brings the total number of Mpox cases in the country to 36 from across 12 counties. The highest number of cases by counties is Nakuru County. Nakuru County has reported 10 cases. Mombasa County, 8 cases. Busia County, 3 cases. And other counties reporting are Nairibi, Kajiado, Bungoma, Taita Taveta, Kericho, Kilifi, with 2 new cases each, as well as 1 case each from Makueni, Kiambu, and Uasin Gishu. You need to note that Nakuru seems to be a very unique county And it's like the apex, the meeting point of very many other people coming from different counties. If you have an entry from Malaba, you have to pass through Nakuru. If you have an entry from right from Uasin Gishu, that road, the meeting point is Nakuru. You're coming from Mombasa all the way through Nairobi, you pass through Nakuru. And hence, you can see the number of cases are quite high. Equally, Mombasa is like the destination point. Anybody coming from Nairobi, going all the way to Mombasa, and probably also coming from Tanzania. The Ministry of Health has put in place a robust surveillance system to quickly identify any potential cases. And this includes close monitoring of travelers, especially those coming from counties where there is an active outbreak, and the provision of timely information of healthcare providers and the general public across the country. The Ministry of Health, again, has taken proactive steps in coordination with key stakeholders, among them who are in the room, that is the World Health Organization, UNICEF, and other partners who have come in handy. We have IOM, we have CDCs, and all the other partners to ensure that we have the necessary capacity to respond. This includes strengthening our healthcare system, providing our healthcare workers with the necessary training and personnel protective equipment, and ensuring that diagnostic tools are readily available in our laboratories. I know we have heightened and enhanced the capacity in our laboratories, and unlike before, and especially during COVID, when we could send samples all the way to even South Africa, this time round with Mpox, we have been able to test each of the samples in our laboratories. And those must be lab people. And you're doing a very good job. They are really, really doing a good job. We have also initiated public awareness campaigns through community engagement with key populations, social and mass media, and dissemination of information, education, and communication materials to educate the general public on how to protect themselves from the disease, and key preventive measures, including proper hand hygiene, as well as enhancing hygiene in hospitality industry, among areas or among others that are vital in controlling the spread of Mpox. I know the last quarter of last year, we were very busy across the country. We met hoteliers, we met truck drivers, their association, we met main key stakeholders who are likely to be giving services, and maybe will come into contact with individuals, and there is the high risk of infection. The role of the media, and that is why we are having this meeting this morning, very critical. As we work on these preventive measures, I would like to take a moment to acknowledge the critical role that the media plays in public health communication. You are very, very instrumental, and especially in the public, that the public receives timely, accurate, and reliable information. There are very many myths that you find out here, and it is the role of the media to accurately report on information, and there should be one source of that information. It should come from the Ministry of Health or stakeholders who are who have authority to speak in regards to matters health, so that as we talk to the public, we can array the fears that they have, and we can also give information on what they need to do to prevent themselves from further infection. So your efforts in educating the public, countering misinformation, and amplifying key messages are invaluable. You know, a simple message like, please wash your hands. It may not even be connected to Mpox as a disease, but you know, the action in itself will help us prevent further infection from the public. So it is through your partnership that we will be able to effectively communicate prevention messages and encourage individuals to seek health care if they suspect they have been exposed to the virus. I want to urge you, members of the Fourth Estate, that we continue working very closely with us and share accurate and responsible information. I have always said we cannot put anything political in matters health. And as we try to roll out universal health coverage, I would want to ask the media that if you have anything political, please do not report on matters health. Let us work together. If there is a problem in this country, it will affect your mother, it will affect my mother, it will affect the people you love most, it will affect people you work with. Therefore, we must work together to make sure that the members of public get the right information. We are looking ahead as a ministry, and we are not going to stop on issues awareness. The ministry is also actively preparing for all scenarios, including the possible emergence of more cases. We are in regular communication with global health bodies and our regional counterparts to stay updated and on development and best practices, because diseases have no boundaries. We cannot stop any. We can only prevent ourselves and make sure that we enhance our surveillance and equally the screening, and especially at the border points. Now that the schools are open, the Ministry of Education again is working very closely with the Ministry of Health to make sure appropriate measures are also put in place to strengthen and including the infection prevention and control measures and on water and sanitation hygiene. As a ministry, last year we rolled out a program that will see us enhancing issues to do with personal hygiene, basic hand washing, use of a handkerchief, should you be sneezing, environmental hygiene, issues to do with vector-borne diseases that are preventable, malaria, sleeping under a net, you know, environmental hygiene, draining of water, stagnant water, issues to do with the diarrhea, you know, preventable diseases that can be prevented through environmental hygiene, water and sanitation. In this country, we still have about 15 counties that practice open defecation, and eradication of the same is our #1 priority. Just ensuring that every household has at least a toilet or a latrine, so that we avoid people going into the bushes, defecating, and when the rains come, it will affect each one of us, whether you have the latrine or you don't. Therefore, to further strengthen the ongoing prevention measures, the ministry is set to roll out the Mpox vaccination, targeting high-risk groups such as contacts of confirmed cases and population that are most at risk of contracting the disease. The media plays a critical role in the key intervention, and we therefore request that you provide accurate factual information to also curb Mpox vaccination infodemics. I will reiterate and say, as much as we are talking about prevention, promotion, protection, should you get unwell, where do you run to? And that is why the ministry equally has introduced the Social Health Authority, because our population will require to go to a facility where you can be treated at any given time. And what is going to cover you? You need an insurance cover. And the Social Health Authority comes into play at this particular time. Because if issues of prevention, we've gone past that mark and you're unwell, therefore you will require to register. Ask the masses to register to the Social Health Authority. Ladies and gentlemen, I would want to state that it is very, very important to note that NHIF would only cover 20% of our population, whereas the Social Health Authority seems to cover 100% of the population of Kenya. And we are riding on the Article 43 of our Constitution that states that every Kenyan deserves quality education, quality health. Therefore, riding on that, every child, any grown-up, will require to register to the Social Health Authority. Before I conclude, ladies and gentlemen, allow me to make a few remarks around the Marburg virus outbreak, which was confirmed in our neighboring country of Tanzania in an area called Kagera. And the outbreak was confirmed on 20th January 2025. Although we had received an alert on the possibility of an outbreak several days earlier, and on the basis of that, we already have heightened our level of alertness as a country. And Kenya is classified as being a high risk of Marburg virus disease outbreak, primarily due to the fact that Kagera region is a transit hub in the region, with significant movement of the population to Rwanda, Uganda, Burundi, and Democratic Republic of Congo, and Kenya. Therefore, as I mentioned, I would like to assure you that the ministry is on high alert, and surveillance has been enhanced at all points of entry into Kenya. In addition, the Ministry of Health, on the 21st of January this year, we issued a press release on the issue of to the public, which you all received probably, as well as an advisory to the counties informing them of the Marburg virus disease outbreak. A readiness assessment in the progress at the national level and in high-risk counties in collaboration with the Council of Governors. Additionally, we are working with all the other MDAs. We have already sent information, our partners, stakeholders, towards developing a robust national emergency preparedness and response plan. And this touches a whole of government approach, a whole of society approach. So each one of you will be expected to have an input in the response plan preparedness to ensure we do not leave gaps as we move forward. And this will ensure that as a country we are adequately prepared to respond to any outbreak in the event such a situation arises. Ladies and gentlemen, I want to emphasize that while the threat of Mpox is real, the commitment is to. We are also committed to ensure that we give the very best for the citizens of this country. The government of Kenya is committed to safeguarding the health of all Kenyans and in ensuring we are well prepared to disease outbreaks and other health emergencies. In this regard, we have made great strides to the response of this outbreak and preparedness for the possible Marburg virus outbreak, and with continued vigilance, effective implementation of the recommended public health interventions and the collaboration of all sectors, including you, the media, I am very confident that we will win against these public health challenges. I want to congratulate the healthcare workforce who have always been at the front line whenever there are these such outbreaks. And I want to call upon all public health officers to take on the gloves and wear their best suited gears so that we can go out there and ensure that surveillance is done. Our surveillance teams, both at the county level and the national government, this is the time to show your prowess. I know you're doing a great job, but I will keep insisting that we can still do better. To the lab people, thank you, thank you, thank you. Give us the most accurate results so that we are able to treat people as they come. Thank you very much, and may God bless you all. I am looking forward to our continued partnership. WR, you very well know, SDG 17 talks about partnerships. We can't do this alone. We have to come together every now and then. There are those areas that you have a strength, and there are those areas that the government will truly come out strongly. And as the government of Kenya, we are on that lane of saying prevention is better than cure. So let's get prepared. Asante sana.
Please, can we have, we as a country in Kenya, but also in the region, are addressing and fighting. PSU mentioned that it has to be a whole of government and whole of society. I also want to add that it has to be a whole of region approach, because you mentioned that the disease doesn't know any geographic boundary. So in July 2024, the Mpox outbreak was announced. IOM, with support from the government of Republic of Korea, was able to redirect some of our existing funding to respond to the Mpox outbreak. And in collaboration with our sister agencies, World Health Organization and UNICEF, and of course with the Ministry of Health and under the leadership of PS and her team, we have been able to support 11 points of entry to capacitate the officials and strengthen the equipment and infrastructure, including Jomo Kenyatta International Airport in Nairobi, Mombasa, land crossings in Busia, and so on. We have trained over 900 officials, both health and non-health related technical officials, in strengthening their capacity. PS, as you're mentioning, some of the basic hygiene practices of washing hands and some of the messaging that we're seeing around the room today, these are extremely critical to fight this outbreak. So in response to that, we have also been able to produce over 10,000 IEC materials to disseminate these public health warnings and awareness raising messages to the populations of Kenya. So we are extremely proud of our collaboration, and I'm also very happy to announce that we just received some additional funding from the United States government to channel towards responding to COVID and, Mpox and Marburg. So again, PS, under your leadership and with the support of your team and our sister agencies, WHO and UNICEF, will be working together. And as a country, as a global nation, we fought something as difficult as COVID-19 together. So I'm confident to say that we'll be able to succeed against challenges like Mpox, Marburg, and any additional public outbreaks to come. With that, kindly allow me to stop here. Thank you so much.
I extend my sincere appreciation to the government of Kenya, the Ministry of Health, and the esteemed leadership present here, Madam PS, DDG, Dr. Sultanet, the IM, Director of Public Health, Dr. Grace, esteemed pillar leaders, the ground trop epidemiologists, risk communication and community engagement experts, all in present. We appreciate the efforts that are being done by all the partners to respond to this critical outbreak, that's Mpox, complemented with other threats, the Mpox, and at Africa CDC, the collective leadership and unwavering advocacy and tireless efforts in combating the Mpox outbreak are truly commendable. Your commitment to ensure the safety and security and well-being of Kenyans and the entire African continent is commendable and inspiring. Africa CDC stands in solidarity with Kenya and reaffirms the unwavering support in this critical endeavor. We believe that through continued collaboration, effective communication, and multi-sectoral approach, we effectively control this outbreak and safeguard the health and well-being of the communities. And we are keen that we will support all the pillars, including the emerging immunization of this Mpox disease, and we will continue supporting the government. Thank you.
Thank you so much, Ensa. Please, let's appreciate it.
And I'm also extending wishes of a Happy New Year on behalf of UNICEF. Speaking now to Madam PS has just left us, and so has the WR, but I think under their leadership, and thanking to all the officials from the Ministry of Health, from other ministries, to the media here and other UN agencies. It's a pleasure being here. Let me start by extending on our behalf the congratulations to the government and to the people of Kenya, including each and every of you in this room, for having managed to date to keep a very serious threat relatively under control as we stand as of today. The caseload in the region is very high of Mpox, and Kenya to date, as you just heard, is at 36 cases. So I think my first point is, as diseases are global and the region is under serious caseload, well done so far. We need to continue as a country to keep high alert on Mpox, as well as on other risks that will keep coming. We are more and more exposed to acute events, which can be outbreaks or other emergencies, and I think the role of all of us is going to be crucial. And therefore, which is what brings us here today, the role of the media is essential. So I wish to thank each and every of the media who are here and those who are not present perhaps today for their effort in joining hands everywhere through the country with through different means to reach out to the population with timely, accurate, and simple, understandable, digestible information about diseases and outbreaks. And before that, also about health. As UNICEF, we are here joining hands with many partners under the leadership of the Ministry of Health for a very simple reason. Disease do not spare children. And as a United Nations Children Fund, we are here to help promoting and protecting the rights of children. And these outbreaks, as any other outbreaks, of course, especially in a country like this, where a vast majority of the population is about children and adolescents, needs a clear focus and attention on them and on their needs. To date, since the onset of this outbreak, or Mpox outbreak, we have joined hands with the government, with WHO and other partners, essentially to facilitate and support actions along three streams: the health response to the pandemic, but also the risk communication and community engagement, which is at the core of the day today for all of us, and actions related to water, hygiene, and sanitation. So along these three pillars, we have managed to mobilize resources and support the counties that have been identified by the Ministry of Health as the high-risk counties. I will not go into the details. I just want to say we stand here, we continue standing here. I would like to thank today the MasterCard Foundation for helping UNICEF to leverage resources to date to support the government of Kenya in its response. We will continue mobilizing efforts and resources as required as this outbreak continues, but also in anticipation of other health risks and hazards that may come to the country. A final word on the role of media. You have seen it on slide, you have heard it from the previous speakers. Your role is critical, every moment, every day, first of all, in keeping the guard high. People may think that with 36 cases, the risk is minimal, and it's not. So the first point is keep people informed about what is happening. You get all access to information from the ministry. Please do help share the correct information, and as you heard, tackle the loads of misinformation that circulate in many formal and informal ways. My last ask, and then I will close it, is as you work as media, please do not forget that children and adolescents are not only a target for your communication. They are possibly the most powerful weapon you have to promote communication. They absorb, they learn, they understand, and they spread through their own behavior messages in their community. So engage them as you work as media into promoting communication about health and outbreaks in the country. I would stop it here, and thanks again to all, and again wishes of a happy 25. Thank you.
We had a good start to the new year, so allow me to also wish you a happy new year. Ladies and gentlemen, it is both a privilege and an honor to address you today at this important media sensitization meeting on Mpox. Your presence here demonstrates the crucial role the media plays in safeguarding public health and combating misinformation, which is critical in times of health emergencies like the one we face today. As you're aware, Mpox remains a public health challenge globally, continentally, and nationally. Mpox has not only impacted individuals and families, but also exposed the vulnerabilities in the healthcare systems, underscoring the importance of sustained investments in preparedness and response across the whole region. In Kenya, our efforts have been focused on prevention, containment, and raising awareness to protect the health and well-being of all Kenyans. The Ministry of Health, in collaboration with WHO and our partners, UNICEF, IOM, Africa CDC, and others, have made significant progress in surveillance, raising awareness, managing misinformation and disinformation, sourcing vaccines, building capacity for health workers, and community sensitization. Even so, while strides have been made in controlling the disease, we cannot afford complacency. One of the most persistent challenges we face is the battle against misinformation and disinformation. Misleading information about Mpox has the potential to erode public trust, delay health-seeking behaviors, and fuel stigma against those affected, unfortunately. This is where your role as the media, ladies and gentlemen, becomes indispensable. The media is a powerful force. You are the bridge between scientific evidence and the public's understanding of health issues. With your commitment to responsible reporting, we can dispel myth, educate communities, and foster trust in our public health systems. I urge you to focus on the following. 1. Verify information. Ensure your sources are credible. Partner with the health authorities and technical experts to provide factual, up-to-date information. 2. Promote preventive measures, as the PS just said this morning. Highlights the importance of hygiene practices, vaccination, and community solidarity in mitigating the spread of Mpox. 3. Avoid stigmatizing language. Language matters. Report with sensitivity to avoid alienating or stigmatizing affected individuals and communities. 4. Collaborate with us. We are here to provide you with the information you need. Open communication would strengthen our collaborative ability to address this crisis effectively. By strengthening our working relationship, enhancing our knowledge of Mpox, and reinforcing responsible reporting, we can empower Kenyans with the knowledge and the tools to protect themselves and their families. Looking ahead, it is essential that we strengthen our collaboration in addressing public health challenges to all Kenyans. To this end, I would like to propose that in the future, we consider hosting joint media briefings led by the Ministry of Health leadership with the lead agencies such as WHO, UNICEF, IOM, Africa CDC, US CDC, and other responding partners. Such collaborative media briefs will not only enhance coordination, but also amplify our shared efforts to promote accurate and timely information, which is vital in combating health emergencies like Mpox. In closing, I extend my deepest gratitude to the Ministry of Health, our partners, and all of you for your unwavering dedication and collaboration. Public health is a shared responsibility, and together we can overcome the challenges posed by Mpox and other threats. Thank you, and with our teams, we look forward to productive engagement in the Q&A sessions. Thank you very much, and I wish you great deliberation.
It's really affecting us, and especially the long-distance drivers and conductors. I think we are the key and vulnerable population. And we play a very big role in transmitting the virus. And also, I believe we also play a very big role in stopping the spread of the virus. I think for a very long time we've not been in partnership with the Ministry of MOH, and especially on Mpox. But I think this time round we're going to work so close with the ministry to ensure that we stop the spread of the virus. On that note, we will say thank you for the invitation, and we are looking forward for the partnership. And I'll just mention a few key areas that, as long-distance drivers, we feel that there are key areas that we can be able to partner with on. Number one is education and awareness. The Ministry of Health can collaborate with the Drivers Association to distribute information materials about Mpox, including symptoms, prevention measures, and how to seek medical care. Drivers are often on the move and may not always have access to regular health checkups, so providing them with the tools to stay informed is essential. Number two, health resources and support. The Ministry of Health can set up mobile health clinics or provide accessible resources to major stops where drivers stop. These clinics could offer on-site vaccinations in case there is, screens and health consultations, making it easier for drivers to stay healthy and seek timely care when needed. Number three, preventive measures. Drivers can also be proactive by following basic hygiene practices, such as wearing masks when necessary, avoiding close contact with those showing symptoms of illness, and maintaining proper sanitation practices inside their vehicles or trucks. The Ministry of Health can provide training on these best practices, ensuring that drivers are equipped with the knowledge to protect themselves and those they interact with. Number four, tracking and reporting. With the assistance of drivers, we can set reliable system of track any potential cases of Mpox, ensuring that proper measures are taken if an outbreak occurs. By having drivers report symptoms early and share their travel routes with health authorities, we can effectively prevent further spread of the virus. Number five, community support and responsibility. In the end, this is not just about protecting the health of drivers, it's about safeguarding the well-being of the wider community. Through their shared responsibility and commitment to public health, drivers and the Ministry of Health can help create a safer environment for everyone. By joining hands with the Ministry of Health, we can help ensure that we tackle this disease effectively and prevent its spread. My urge is we work together to protect ourselves, our communities, and the essential services that keep our economy moving. Remember, drivers, we play a very big role because we move the economy. By number one, we transport cargo, and number two, we also transport passengers through the borders. So we play a very big role, and I think working together will help minimize the spread of the virus, and our involvement in the campaign and sensitization is also key. I would also like to urge the media, because the media also, they are key partners in sensitization, the campaigns. We encourage them to focus on the importance of early detection, prevention, and the role drivers can play in stopping the spread of the disease. Drivers are not only essential workers, but can also act as key partners in the public health initiative by spreading awareness within their communities, following hygiene protocols, and seeking care at the earliest signs of symptoms. I think that is the message we have today for you, and tunashukuru sana for the ministry. We are looking forward to working together with you. Please open the door for us, because the doors have been locked for a very long time. So, asanteni sana. God bless you.
Let me shake your hand. Thank you so much, Elijah.
That addresses all the health matters of long-distance truck drivers. So we are happy to be here. For us, we will not report that this is the first time that the Ministry of Health is engaging us. We have come some way with them, and we are grateful because I want to acknowledge the fact that in the first meeting we requested for materials which we got, and we have spread these Mpox materials along the Northern Transport Corridor, which runs from Mombasa all the way to Malaba. So thank you, Ministry of Health, and we look for further collaborations. So I appreciate the invitation for this media briefing today. We are happy to be here and really emphasize that long-distance truck drivers is the majority population at risk of contacting Mpox, and not only Mpox but also Marburg and most of these emergency conditions. So we really hope that the ministry will continue engaging the union to be able to reach out to truckers. Truckers are a very challenging population, I must say, because they are highly mobile, yet they are at risk of so many infections and bringing most of these infections in the country. So the fact that they are highly mobile makes it so hard for them to access health, makes it so hard for them, if referred, to be linked to care and treatment. They also have a lot of information gaps because they are mostly on the road, and I appreciate the fact that we have the media here just to help us in reaching out to truckers, especially the radio. Truck drivers listen a lot to radio and basically any other media. So we hope that we can be able to reach out to truckers because they have a lot of gaps when it comes to information, yet this is the population that is mostly high at risk of infection. I also want to encourage us to look at the contacts of truckers. As we all know, Mpox is equally sexually transmitted, and truck drivers have multiple sexual partners along the highway corridor. So it is important to also look at their contacts and their family at home so that we are able to have it controlled among all these populations. So the union has resource centers along the highway corridor, mostly at the way bridges and border points. As we reassure our commitment to all partners and the Ministry of Health, we invite you to utilize these platforms because they are easily accessible for truckers, because they are at border points and they are also at the way bridges, so that we can be able to offer services to truckers. There are parking spaces because you find that most of the public health facilities are not along the transport corridor. So a truck driver will rarely stop because they need a place they can park to be able to access these services. So we open up our resource centers along the transport corridor that we can be able to work together and be able to offer services to the long-distance truck drivers. So as I end, I want to again reassure our commitment as the Kenya Long-Distance Truck Drivers Union to work with the Ministry of Health and all other partners interested with working with long-distance truck drivers. Asante sana.
On the Kenyan situation. Before we get into the Kenya situation update, let's first go through the outline of the presentation. Okay, so first we are going to go through a basic introduction to Mpox. After that, we are going to look at the situation in Kenya and some highlights of the response which has been going on since the outbreak was confirmed in July last year. And then we'll have acknowledgements. So Mpox is a viral disease. It's caused by the monkeypox virus. And this virus belongs to the same family as the variola virus, which causes smallpox. It's a zoonosis. A zoonosis is a disease which affects both animals and humans. So the animals which are affected are usually the small mammals, like the monkeys and the squirrels, and it also affects humans. So the transmission can be from animals to humans, and it can also be from human to human. So this is just a graphic showing some of the mammals which are affected. On the left of the graphic, we can see the animals there. So people come into contact with them when they are handling them. The people who go to hunt for bushmeat, and also during the preparation of the bushmeat. And the contact can also be bites or scratches from the animals. Then on the other side, which is more relevant to us in Kenya, is the human-to-human transmission. And this occurs through direct close contact with somebody who has Mpox. It can also occur through respiratory droplets when you talk face-to-face with a person who is infected for a long time. It can occur through needle injuries, as may happen when people are getting piercings or in health facility settings. It can be vertical from a pregnant woman to an unborn child, and it can also be sexually transmitted. This is very relevant to us in Kenya. This is one of the main ways that it's getting transmitted in Kenya. So, next slide. I'm very proud of this slide. These are the symptoms of Mpox, and this analysis was done for our first 23 cases in Kenya. So these are actually the symptoms that were reported by patient 1 to 23 with Mpox in Kenya. So we can see that most of our patients reported that they had rash. Actually 100% came with a rash. Then fever, sore throat, genital lesions, body weakness, just feeling generally tired, joint pains, and oral lesions or lesions in the mouth, and so on. So this is actually our Kenyan data of what our patients with Mpox complained of. So why should we be concerned? So many people have been wondering and asking, should we really be concerned about Mpox? Why are we making such a big deal out of it when we just have 36 cases? Is it a big deal? Should we be bothered, or should we just stop and forget about it? The answer to that is that we should all be very, very concerned about Mpox because one, while most of the patients recover from the disease, there are some populations who are very vulnerable. These are the young children, pregnant people, and people who are immunocompromised. Immunocompromised people are, for example, people who have HIV, which is not well controlled. So these vulnerable populations may get severe disease, and Mpox actually can cause death. And many people have died because of Mpox and its complications, so we should be very concerned about it. We have even one person who died in Kenya from one of those vulnerable populations. Then apart from that, it can also cause complications. You can see like the patient who is illustrated there, her skin is extensively involved by the disease. You can see the lesions are all over. These lesions can get infected. Sometimes they happen in the mouth, so the person has difficulties with feeding and drinking. The lesions can get infected, and the infection can spread through the blood, what we call sepsis. And sometimes even the eyes can get infected and people can get loss of vision. So while most cases of Mpox are fairly mild and the people recover, it can be quite serious, and we should be very concerned about it. Then in addition to that, there are also the psychological and the social and the economic complications. You can see a patient like this with lesions, she can't even go in public. She'll be very stigmatized. She cannot attend her work, or if she's a student, she cannot go to school. And if the patients become very many, then the health system can get overwhelmed. So we should be concerned. Next slide. So there are different types of Mpox virus. We have what is called clade 1 and clade 2. In Kenya, it is clade 1B, which is circulating, and it appears to cause a more severe disease than the clade 2. In addition to that, it's associated with a higher rate of human-to-human transmission, like what we are seeing in Kenya. It spreads easily between people. It affects all sexes and all age groups. If we remember, in 2022, we had an outbreak, a global outbreak, which was primarily involving the men who have sex with men, and that one was caused by clade 2. that outbreak remained primarily in one population. Ours is affecting all ages and all sexes, and there's a lot of heterosexual transmission. That means between men and women. So we should be very concerned in our setting. Next slide. The map. No, go back. Yes, that one. So here I just want to highlight to you about Mpox clade 1B. Everywhere where you can see blue, in the Central Africa, in the Democratic Republic of Congo, that is where the outbreak, that is where clade 1B was first detected, and it was actually detected for the first time in 2023. Since that time, it has caused a massive outbreak in the Democratic Republic of Congo, and it has spread to other countries in the region, including Kenya. This is clade 1B, Rwanda, Burundi, and Uganda. These countries like Kenya, Rwanda, and Burundi have never had Mpox in the past. This is the first time we are encountering Mpox, and it's because of this clade 1B. So we can see that it has a high outbreak potential, and it has left where it started in the DRC and spread to other countries. If you look at the other continents like the North America and Europe and Asia, that is India, I'm sure you can see where India is, you can see that the 1B has also spread to other continents. It is yet to cause an outbreak outside of Africa. These are mostly imported cases where somebody travels from Africa, travels to Africa, gets infected, and goes to either Europe or America or Asia. But you can see 1B, it has really spread, and it has spread in a short time, 2023 to 2025. So that's another reason why we should be very concerned. Next. So let's come closer home. This has been very well outlined by the speakers who came before me, especially our principal secretary, but let us just go through it for emphasis. So in Kenya, we declared our outbreak on 31st of July 2024. Our patient number 1 was a truck driver, and he was detected at the border between Kenya and Tanzania at our border crossing at Holili, Taita Taveta County. So subsequently, and until now, we have 36 confirmed cases, and the cases are spread in 12 counties. So the map that we have there is just showing us the counties where we have cases of Mpox, and you can see a very clear pattern where the cases are distributed along the transport corridor that goes from Western Kenya until the coast. We can also see involvement of counties along the border with Tanzania. That comes out very clearly in the map. So our outbreak is still very active. Our most recent cases were reported on 20th of this month. So just within this week, we reported 3 more cases in Kilifi and Busia counties. So very much an active outbreak. 32 of the patients have recovered. This is a very good thing, but 2 are still admitted in hospital. 1 is on home-based care, and unfortunately we lost 1 patient in Bungoma County who was one of the vulnerable populations who we have mentioned. In Kenya, females are more affected than males. We have involvement of about 61% females. So this again is work done by our team for our initial cases of Mpox, and all I want to show you there is that it's distributed across all age groups. So from age 0 until age 60, we have cases, but the most affected age group is from around 30 years to around 44 years. So that is clearly illustrated in the chart, which is showing right now. Next slide. Okay, so something else very relevant to us is the occupations which are involved. We can see truck drivers are the highest number, although this was a bit earlier in the outbreak, but we can see that at that time the truck drivers were the most involved population, followed by business people and female sex workers. It's also important to note that we have children, we have some students, these are secondary school students, and other professions. So these are the occupations, just to give us an idea. And it's a very good thing that we have our truck drivers represented in this meeting. We really need you in our response. Next slide. So what have we been doing? We've been having a very active response. It is led by the Ministry of Health, and we are very well supported by our partners in the response and our stakeholders. So a very big thank you to all our partners and all our stakeholders for your support. Thank you so much. So in terms of coordination, we have a coordination structure in place. I'll show you how it looks. We hold regular coordination meetings, and we have an Mpox emergency response plan, which is illustrated there. Next slide. Okay, so what this is showing is our response structure. This is what is called an incident management system, and it is led by a task force chaired by our principal secretary, who was here with us. That is our highest decision-making body. They offer us strategic leadership, and they also assist us with resource mobilization. So below that, at the operational level, we have what is called an incident management system, and this is led by our incident manager, who is our Deputy Director General for Health, who is here with us. He's here. Then we have 4 sections. Operations, that's the main section. These are the people who deliver the interventions. We have risk communication and community engagement. This is the group that has brought us here today. We have our health worker capacity building. We have infection prevention and control, case management, the ones who guide us on taking care of the patients. We have mental health and vaccination. Then these other sections, plans, logistics, and finance administration, our job is to support the operations team so that they are able to deliver the interventions very well. Next. So we've talked about the risk communication and community engagement. They've done a fantastic job. We can see the materials they've created all around the room, and even the one projected there has been created by this team. And they've been doing great dissemination, press releases. Each time we have a new case, this team ensures that a press release is given so that the public can know about the cases. They also do a lot of social media. They did some TV and radio dissemination last year. They do direct community engagement, advocacy meetings like the one we are in now, and of course, as we've said, information, education, and communication materials. Next. Very important, enhanced surveillance at our points of entry. Our teams at Port Health have been able to screen over 3 million travelers for Mpox, just to make sure that we don't get cases coming into the country from outside. They also do contact tracing. This means that whenever we have a case of Mpox, they go and find out who are the people who came into close contact with that person, and they follow up those contacts just to make sure that they are okay and they don't develop Mpox. So we've been able to list 244 contacts, 216 completed the 21-day period of follow-up uneventfully, 19 are continuing, and 9 developed Mpox while they were on follow-up. So we also have what are called rapid response teams. These exist at the national and the county level, and their job is to be deployed to an area which is identified as a hotspot for Mpox. The most recent teams that we deployed from the national level, they went to Nakuru, which towards the end of last year was having very many cases. So there's a team that went there. They actually went in December over Christmas, and they just supported the county teams in controlling the outbreak there. And another team went to Mombasa. Okay, the laboratory, this team, we can't thank them enough. They have a sample management system in place. Our testing is happening at the National Public Health Lab. So there's a very good referral system so that the samples can come and be tested. And there's also a quality assurance system where they share the samples with other labs just to make sure that there's concurrence in the results. So they've tested 386 samples which have come to us from 38 counties. 36 have been positive, 348 were negative, and 2 are pending. They are still in the process of testing. We are also doing health worker capacity building. We've done quite a number of trainings. The image there is a training that we held with the county health teams from the coastal region, just to educate them on Mpox. And now these county teams are educating at the sub-county and the health facility level. We also have guidelines for Mpox. So as I come near the end, the Ministry of Health and all our response stakeholders are very committed to controlling the outbreak. We are very committed, but we all have a role. The media, the public, everybody who resides in Kenya, we have a role. And what can we do? We need to observe strict hand hygiene. This is hand washing and use of hand sanitizers. We need to avoid sharing personal items such as clothing and beddings and towels. Each person should use their own. If we detect symptoms in ourselves or in somebody close to us, we need to report to the nearest health facility so that we can be evaluated. Not every rash that appears is Mpox. So one needs to go to a health facility so that you're tested, you get a diagnosis, and receive the right care. Then, very important, we need people to be responsible in their sexual conduct, either abstain or be faithful to a partner who is also faithful to you. Avoid multiple sex partners. This is a risk factor for Mpox. So acknowledgements, I need to acknowledge the Ministry of Health, both at the leadership level and my colleagues. Thank you so much for everything that you have done for this response.
Thank you very much, and may God bless you all. I am